the ideas of a forward-looking view of the internal medicine in Israel. I'm going to start with a few details about the internal medicine departments in Israel. The first statement is that the Department of Internal Medicine in Israel are the base and the heart of the public hospitalization in Israel. By saying that, do remember that there are 108 internal medicine wards around the country, about 1,300 physicians, about 20% of the total hospital beds are in internal medicine, about 250,000 admissions per year to the internal medicine departments around the country, about 1.4 million hospitalization days per year. On the other side, 4.3 days of average hospitalization duration in Israel. It's one of the lowest numbers in the OECD. 97% of occupation during all the year, winter, summer, holidays at the departments. Again, one of the highest average hospitalization in the OECD. Okay, the profile of the patients and afterward of the physicians in the internal medicine department in Israel. Let's talk about the patients. They are old, they have complex morbidities, either whether they are old or younger, multiple clinical needs simultaneously. Most of our patients have several acting problems during the hospitalizations. And as a matter of fact, the internal medicine physician nowadays act as a case manager to control between the problems and the physicians who are taking care of each one of the problem. On the other side, there is an inadequate patient-staff proportions. When we are talking about the physicians, we are talking about a problem with the senior physicians, inadequate patient-staff proportion. Again, there are not enough senior physicians in the internal medicine departments. About the interns, they are doing simultaneously a few things. They are treating the patients, they are teaching, they are learning, and they are training. All of these acts are done simultaneously. And we also have students, and there are going to be more and more students in the next few years. And it should be remembered that the internal medicine department is the first place that patients are meeting the clinical life as a physician. And when we are talking about the future, we think that the internship and even the teaching students should be according CBME as part of their training. The dilemmas that we are in front of them. The first thing, as Leah said before, is the feeling that there should be some kind of physical relationship between us and the patients, and its most important thing is compassion. Medicine should be, at the end, personalized medicine. It should be professional, and there should be advanced teaching skills as we go on during the years. And, of course, we have a lack of resources. So how can we do all these things? How can technology support the principles of internal medicine? Let's talk about technical innovation. We think that it should include improving the communication between us in the hospitals and the primary physicians. There is a huge problem concerning mistakes especially considering medications and dosages, because we're dealing in very complex patients with impaired renal, liver function, and there should be a lot of care about medication and dosages. Another thing is improving the monitoring and the follow-up care of patients in the ward. We are talking about complex patients in a very crowded wards. And we should also take care of collecting data and creating database for the future. Another two things is the expansion of the hospitalization at home and remote medicine. We think this is a very important part in the future, and to take also care with big data and AI, considering the data that we can collect in the internal medicine departments. However, we think that non-technological innovations are also very important. And we are thinking about preparing for the future scenarios, because we believe that the COVID pandemic was just the first one, and we are going to face around the world, and even in Israel, another pandemics, climate change, and other diseases and situations, and we should be prepared for that. And the internal medicine, because we are in the front, we should be prepared for that. The second thing is updating the internship programs and so that we will be able to prepare physicians for the future. So in summary, internal medicine innovation goes beyond technologies. To handle the next challenges, we will need to expand the way we think. We need to be thinking about new medical fields, new tools, and new ways for teaching and training our interns and students. Thank you.
Thank you very much. Thank you very much. This was